Welcome to Spectrum Perspectives, real talk with parents, professionals, and autism advocates, with your host, Cindy Gellermini.
We just did a case in Mississippi. We've done other cases. The whole goal here is to start educating the entire population, parents, physicians, school teachers, that when you look at a behavior, you must think that maybe there's a medical issue going on.
Right.
Something triggered that situation. So for me, my area of the next future is as we talked about earlier, is how do we fill the whole gap of medicine, comorbidities? We've got these great minds. We now need boots on the ground. When I was starting off and Mikey was there, I said, I don't want to be his doctor. Nobody would take him. They said, we don't deal with autistic kids. I'm like, what are you talking about? But as a physician, and I understand it. I mean, they're going to take up time in the office. They're going to be loud. The lights have to be low. So I was his doctor by choice. And, a lot of people don't have that luxury. And it is time consuming. However, because I said to you earlier, there's over 900 physicians, a lot of us are out there with kids with autism in all specialties. So the next push that I had several years ago was at the medical school that I trained at. I took a program that I started with my daughter way back, and I used to run their in-town rec leagues. And everybody noticed that we were a very successful team, soccer and baseball. And all of a sudden, they knew I had a child with special needs, so they started putting their kids with special needs on my team. And that was a disaster. Okay, that was not right. And I thought to myself, you know what? It's time to leave. And I think that it's time to start what I consider sports clinics, especially for special needs, basketball, baseball, and soccer. And let's bring in my colleagues who are occupational therapists and speech therapists and OTs and trainers. And let's kind of look at these kids and figure out, how do we work with them? I don't care if it takes 6 months or a year or 2 years, but our goal was to reintegrate them back into the rec league, so they were indistinguishable from their peers. And we did that. We worked on it, and it was truly amazing what went on. And my daughter, at 10 years old, was running all the volunteers, because everybody wanted to do the special needs program for soccer, for athletics. The cool thing was that we had a lot of athletes, Mariana Rivera, Jason Kidd. They all wanted to do this program. They all wanted to learn about what was going on with these kids. And they made me walk around and tell them each about their story. And it got to the point that their siblings didn't want to play rec. They wanted to come do this, because this was a cool place. They got prizes. It was great. But then you had to deal with the family dynamic. And I was able to do it. I could have the fathers and the mothers, whatever. And the notes coming through where the kids were going back in the rec league. They went 2 for 3 at the plate, baseball, made it all worth it. Or the hugs and the kisses. Or the one story I will never forget, girl with Down syndrome. She slept with the basketball all Christmas break and couldn't wait to come over and tell me what she could do. I mean, you're tired. It's 7 o'clock at night, but you're energized. And those sports clinics were very powerful. Everybody wanted to volunteer to do it. And the reason I bring that up, we had won the award, the governor's recreational award, which was an honor, the highest award they got, because of the reintegration that we did with these kids. But one of those kids, who was 13 at the time, who I then got into medical school, called me a couple of years ago and says, hey, I want to do a buddy program, with these kids, like we did when I was 13. What do you think about it? And I said, wait a second, let's twist. We will sponsor it. The goal is to get these medical students. I don't care if you're going to become a plastic surgeon. I don't care if you become a psychiatrist. I don't care what, a bariatric surgeon. You're going to come across this population, because they don't stop becoming autistic. As we all know, they become adults. Why not desensitize them right now? And we started the sports clinics with the medical students, and it's a hit. They had the professors come. The medical students are now all starting to be exposed to these kids in a very fun way. Mm-hmm. And that is the groundswell that I'm focused on. Okay, now we check that box. Let's get more medical students involved early on in their career before they pick their specialty. The next groundswell is, okay, let's start taking a lot of what I know, and I've given lectures to the medical school. Let's give it to the residents, part of their curriculum. And that's what we're doing now. We're working, Rowan is doing it, Robert Wood is doing it. We're starting to infiltrate it into the primary care curriculum, which is what we need to start doing. We need to start getting it out there. Primary care physicians getting very comfortable and learning about all these medical comorbidities. The next goal will be to train primary care physicians, the residents themselves, as well as educating the subspecialists, the GI and neurologists that are here, and connect the dots with our experts. And we are starting to do that. So we've got to make the whole continuum up and down so that nobody is faced with this issue. One of the new projects that I'm focused on right now here at Robert Wood is to work with BCBAs at Rutgers. Christopher Menente is a dear friend of mine. And I believe they should be part of the medical team. When these families hit the emergency room, I know I used to work in the ER sometimes. I worked in urgent care centers during my primary care between my residencies. There was chaos. And they come in the door, it's a frightening experience. And $895 to walk in the door, $1,000 plus worth of tests to find out what, you had a sore throat or an ear infection, right, or God knows what, or you get a shot of Haldol. I mean, that was what went on. So why not have them part of the medical team? You come for a pre-op for a procedure or any kind of procedure in the hospital. You need to have special needs. You have to have BCBAs be there. Calm the family down. Calm the child down. Get the lighting right. Get the food there quickly. Get them in and out. This is the push that we're working on right now. We need to deal with this population because one of the things that I spoke about when I had received the Jefferson Award in Washington, I spoke to the senators. I said to them, and Republicans and Democrats, I said, autism doesn't discriminate, black, white, rich, or poor. It's coming. That's number one. And it's going to come to hit your family or somebody else close to you. The second thing that I can assure you is that while you're worried about the Medicare and Medicaid system because of the baby boomers, look at this freight train. This population is going to be on the system for 30 to 50 years, and they're going to blow the system. So you should start focusing on this population. Look at the unnecessary admissions that are going to the emergency room and these readmission penalties. This population needs a lot of attention right now. And here's another thing. We haven't found a cause. And the numbers are now 1 in 35. I saw the other day in Boise, in New Jersey. It's in every state, every Boston, Florida, New Jersey. So we have an epidemic or pandemic, if you will, that's going on. And we're so far behind. As Bob Wright said one time, my daughter started Autism Family Night, which I'm so proud of, where it started in New Jersey and it went all around the country. When she was at Mount Holyoke, they had to create a project that would change the world. And she came home one day and I said to her, you know, it'd be really cool. It'd be nice to go out as a family and not be stigmatized, you know, by the noises and screaming, whatever. You know, my money's as green as everybody else's, you know, come on, let's take a slow night. I used to work in a restaurant business, washing dishes and doing anything, bartending when I was a kid. And we went to TGI Fridays and she went in, she told them what to do on a Tuesday night during the month of April. They opened the place up. She worked with the waiters, waitresses, got the food. And all I saw was a group of people actually happy, smiling, and being a family. And kids were going on and were like, don't worry about it. Don't worry about it. You know, it's cool. And there were lines out the door. And they realized this was a guy. And she was on the news and she won the award at Mount Holyoke. She ended up going to the United Nations and being honored for this. And I remember Bob and Suzanne Wright. Suzanne had passed and CDC, everybody was there, Linda Beccaro. And Bob Wright said pretty succinctly that we're 10,000 feet apart. This is our problem, and this is where we are. I will tell you that we are here 20 years plus years later, and we're still this far apart in medical, in residential, which we haven't even got to, and we need a lot of work to be done.
Right. And this is what I've been saying, you know, when Robbie was diagnosed, it was like 1 or 5 in 10,000. And we went from that to 1 in 32. And he was at the beginning of this freight train, you know, and I've been saying now there's so many kids, it's a tsunami that's going to hit and we're not ready. We're not ready. You got to do something about it. Something needs to be done. And I just don't understand what it's going to take. well, I know what it takes to wake people up is to have an autistic kid yourself.
Right.
That's how things get
Well,
done.
I mean, absolutely. And like I said, it's 6 degrees of separation. Every time I give a lecture at the medical school, at one of the alumni, my first thing is, how many people have a child or a sibling with autism? And hands go up.
Mhm.
Okay. How many people have first it's a child, how many people have a sibling? How many people have a cousin or nephew? Keep your hands up.
Mhm.
Okay. How many people know somebody? And before long, 95% of the room, their hands are up.
Mhm.
That's terrifying.
Mhm.
Okay. And you're absolutely right. When we first looked at the housing list, okay, back in the day, we haven't talked about housing. There were 6,000 people on the list waiting to be placed in New Jersey.
Yep.
And they were only placing, how many on the emergency list were 200? They were placing at that time 50 people.
Mhm.
Today, there's 17,000 plus people on the list. They've only placed 200 last year. And this is still the emergency list, keeps growing. And
Right.
every year, 1,000 new kids go on the list to be placed.
Mhm. And where are they going to go?
Where are they going to go? They're going to outlive us.
Right.
They're living with their parents. I built finally an addition on my house. I remember because, there was so much chaos here and I was trying to bring normalcy. So I built an addition for his staff and him to live, and we can work together. It's like a suite. And people are like, wow, you must have really hit the jackpot. No, I borrowed a mortgage on my house because I needed to take my house back so that maybe my kids could have some sort of life where it's not constantly staff and people. It's like a 3-ring circus going on.
Right.
That we could shut the door and be a family. And then when he's okay, we can work together. But, the residential piece, I always say there's 3 lanes. There's the medical lane, which I've lived, and that's where I'm staying in right now. There's the vocational lane, which is very simple. How can this population have a purposeful, meaningful life? I don't care what that is. It could be farming, it could be packaging, whatever it is. That's all we ever want with our kids anyway, right now. We tell our kids when they go to college, find something that's purposeful, meaningful, and you can be happy doing every day. I want to see a smile. I don't know what that is. Everything's changing. In this population, there's a big push in the vocational world. I know some good people that I'm working with right now that are doing just what we're saying. Then, of course, the other 3rd lane is the residential. How can you have and create supportive housing that will be, number 1, sustainable long after that you're gone, that they won't go out. Number 2, how can you make sure that the staff is nothing but paid the best and getting the brightest that they can, because what they're doing is something that we as parents find very difficult to do. God bless these people that do it, like your daughter. Okay. And the 3rd thing is they should not be a burden to their siblings. They should also be having a productive, meaningful life while they're there. It should be a community. It should be thriving. They should have medical care. And that's where I'm focused on right now. Technology has brought us to the level with telemedicine that we're starting to push in that direction right now. Concierge, 24 hours. I've already worked with urgent care centers and ERs and trying to keep these adults in the places that we're trying to create right now, an ecosystem, if you will, where I have residents. Like I was trained in a nursing home in primary care. We're all assigned, and then we had a preceptor. I will be assigning all these students, residents, with my colleague, Dr. Talia. He's the chairman of family medicine at Robert Wood. We together have wanted this for years. We will be assigning the residents to all of the residents in the community that we're building. And at the same time, I will be precepting them. I will also drop the think tank right in there at the same time.
I just have to tell you this, it's so needed. And I'm so happy to hear you talk about this, because I was so frustrated as a mom where, my son, Robbie, he had very high arches in his feet and he seemed to be in pain when he walked and his feet turned in. And I would take him to one doctor and he wanted to do surgery on him. And then he sent me to somebody else. And then he would yell at me and say, well, of course he wants to do surgery on him because he's a surgeon. That's not what he needs. And, and then somebody else was like, well, look at his hands. And what's his diagnosis? I'm like, I don't know. And he says, well, autism doesn't cause what's going on in his hands, and then they sent me to a physiatrist, and then he tells me he's got neuropathy, and well, what's causing the neuropathy? I don't know. And then he was vomiting every weekend my son had diarrhea, and I try to explain this to people. I said, you know what it's like when you have an infant where it's all over his clothes and his crib. Imagine cleaning that up on a 19-year-old, okay? And that how my house reeks, and and the laundry and the constant diarrhea, and then every holiday, like every 6 weeks, he would start vomiting, and he would vomit every half hour until nothing was coming out but green stomach bile. And I would call the doctor, and they say, oh, he's a stomach virus. I said, you don't get a stomach virus every 6 weeks. What is going on? And nobody had an answer for me. I took him to a GI doctor, and I said, I tried, they tell me to take him off the gluten and the dairy. She says, does that help? And I said, no. She says, don't do that. But nobody had an answer. And I had to go like a ping pong ball to all these other doctors, and they never talked to each other. And I felt like nobody knew autism. They're treating individual symptoms in his body, but they're not looking at him as an autistic child that, And the one thing that finally helped his digestion actually was after he had his first seizure. And when I put him on seizure meds, he calmed down, his body calmed down, and his nerves calmed down, and the GI stuff stopped, but that just happened because he happened to have a seizure. Otherwise, how would I, you know what I'm saying? So the whole thing is so frustrating. And I've always said, I wish that there was, I wish these doctors would all get together and all talk to each other and discuss my son, and let's come up with an answer. And please tell me what is causing the seizures and the vomiting and all that kind of stuff. So, thank you. For me, it's too late. I listen to it now, and I wish to God that I could bring Robbie to a place like that so you guys could have figured it out, but it's too late for him because the seizure killed him, and and that's why I'm very passionate about this, because I hope to God that it doesn't happen to any other parent.
Well, we had a case, to your point, and I think you're touching upon it, and I bring this up a lot of times at grand rounds. There was a case that similar 21-year-old who was doing fine, was in a group home, and he started wetting his bed. He hadn't done that for a while. So they called the urologist in, and the urologist came in and said, it's a behavior. And he said, everything, no UTI, it's a behavior, fine. And then he started soiling his sheets. And they called the behaviorist in, and they did some behavioral program. And then they called the GI doctor, and the GI doctor said stuff. He says, no, it's autism, it's his behavior. And all of a sudden he's soiling his sheets and he's urinating where he wasn't doing that before. Then he wasn't eating as much. He started not eating. And they said, GI came in, reconsulted, and basically said, it's a behavior. Do this, 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 and that. And that did not change. Then he started to all of a sudden start ripping off his shirt and becoming violently aggressive at night. And they said, let's put a behavior program in place. This was in the group home. This was going on and on and on. And the parents, pretty well up, they brought him to me. They said, do you treat autistic adults? I said, I treat everybody, okay? And I just listened. And I said, how's his eating? And they said, it's not eating as much. I said, I'll tell you what, I've listened to your story. You've named 3 things. I ordered an MRI of his cervical spine. He said, what? Trust me. Ordered an MRI of the cervical spine. The neurosurgeon at the hospital called me up. He had a tumor that was encroaching on his spine, that was causing his bowel and bladder. I told the story to Lonnie, Dr. Zeltzer, and she got it right away. The point is that too many things are being missed. And part of the problem is, and this was a comment that was made offhanded to me, and I took it seriously. They said, why is it that veterinarians can treat dogs and cats? They probably treat them better than we treat kids with autism who are nonverbal. And I thought about that one for a while, and I said, well, how do they treat them? How do they diagnose them? Because my son's not going to tell me, oh, I feel stomach ache, or I have a headache, or I'm irritable, or I'm cranky, or the side effect of the medication is bad. You're not getting anything. I got about 30 seconds before he loses his shit, and out he goes. So I went into a chat room of the most prominent veterinarians, and I posed the question, how do you figure out what's going on with the cat or dog, whatever's in front of you? And they said, look at this human doctor, ask this question, and we applaud him for it. And the answer was, very simply, we are trained to listen and to observe. Human doctors just order tests.
Mhm.
And he is exactly right.
Mhm.
I went back to and I told the story to the chairman, my dear friend, Dr. Talia, and I said, you know what? It's true. The medical residents and students that rotate through me immediately just order tests.
Mhm.
Back in the day, we had to do a good history and physical, okay? We didn't have CAT scans. They were just starting out. MRIs weren't around. We actually listened to the parents. We listened. We tried to figure out what was going on. And if you do that, a lot of times, you could figure out what the story is. And then you order tests.
Mhm.
There's the reverse. My focus right now is to get back to letting people start listening and figuring out, look, you're the caregivers. You're the people that are out there. You know the child better than us. What is going on? What changes? What something is wrong. And then it should just click, create a differential, go down there. But unfortunately, you're right. People just come in. It's very myopic. This is my area of interest. That's what it is. Boom. I don't see anything. I move on to the next one.
Right.
But if
I'll tell you one time, Robbie fell.
Kids,
One time Robbie fell off of the top of a slide and he hit his head, and my husband immediately took him to the emergency room. And they said to him, they were asking Robbie questions, and my husband said, well, he can't talk. And the doctor said to him, well, how am I supposed to figure out what's wrong if he can't tell me?
Yeah.
And my husband was so angry. He says, how does a vet treat a dog? They can't talk to you. How do they know what's wrong? So it's funny that you said the exact same thing.
Yes, it was my wife who said that comment to me in a snarky way.
Yeah.
But no, I mean, I could tell you a story. How do you treat a patient? Right. I mean, you bring these kids to the emergency room and they're combative. They gave Haldol and then send them to the psych ward. That's what they did for many, many years. I'm trying to stop that.
Right.
There's another thing that I will tell you is that in this group home, there's another story that came up that I won't forget because it sticks with you. They're a very close friend of mine. That it was Christmas Eve, and of course, the adult, young woman, was having pain, so they quickly just called reflex. They just called an ambulance. Now you took a situation where you put this child, she becomes in an ambulance with a siren, frightening, who starts becoming very behavioral, to an emergency room, more intimidating, more upsetting, with lights and people running around, unfamiliar, strapping her down. The parents were coming in, seeing this, and the doctors couldn't examine her. It went on and on and on, lots of tests. Back in the ambulance, after it was over, went home. What was the diagnosis? Strep throat. I mean, was that
That's
necessary?
Their protocol in these places, though. It's
and
like
that's Daniel's law. That's Daniel's law. And I spoke to Senator Keene, and I understand why it was, but not when there's telemedicine, not when you can start changing that. And he's a big proponent of telemedicine. Unfortunately, he didn't get reelected, but we had this conversation a year ago. That was a traumatic event that should never have happened and should never have cost taxpayers that kind of money, never should have gone to the ER. Our goal is to try to keep those people, those beautiful children, adults, or actually they're adults, where they are, give them the best help they can with the best staff, and use telemedicine and use the resources we have. Hell, we treat people with dementia and Alzheimer's for years. As family doctors, such as we did. As rehab physiatrists, we do the same thing. A lot of us do. Why is this population any different? It's very similar in some respects. My mother unfortunately passed away during COVID. She had dementia in late stage. She was a special ed teacher, but I watched her Alzheimer's and dementia go on. But they connected, my son and her. And the heartbreaking part is that I saw the similarities, the unpredictable nature, the belligerent, the change in environment, didn't do well. But the point is they connected through, in their case, horticultural therapy, which was wonderful. They were doing plants. But my point is that we need, and I will keep banging on this till I stop, and I'm moving the dial. We need to train more physicians and staff and get everybody involved, nurses, LPNs, to the issues of this population. And you have a 30-second window. There's a program that we want to get funded, and I'm working with, again, Christopher Menente on this one. It was terrific, where just what you said in the beginning, he is a board-certified BCBA PhD colleague of mine who basically wants to start a crisis day program, intervention center for a day program. The goal here is that we work together. If he uses behavioral techniques that have been proven to calm this adult down in crisis then come and let me examine with my residents and students. I have that opportunity. Give me 2, 3, 4 minutes. I do a quick systems check, and I'm also listening to somebody at the same time. Maybe we can prevent, I'm sure we can, these unnecessary admissions or unnecessary doctor's appointments. But collaborating together, that hits your first question. You know, back in the day, nobody was doing that. It was all one way. Now I think we've come to realize that not all behaviors are behaviors, so we work together. And of course we have to do it. The lighting is down, the music is down, we listen to the parents. You know, several times I'm called on a plane. I was just recently called on a plane. Is there a doctor? I come back. The guy has passed out. He's in the back. The parents are sitting there. They're upset. I say to them, as I come over them, start telling me his medications that he's on. You tell me his past medical history. Start going through the list. Then you start examining him. I have somebody else doing their pulse. You know, an EMT happened to be there. Get me his vital signs. Looking for something. I haven't even touched him. And it became quite evident that he was just a diabetic. He wasn't having a seizure. He wasn't having anything else. And the stewardess were like, should we go or not go? Give me a thumbs up. Give him some orange juice. This is where we were. And he was fine. He woke up, he just didn't take his pills. You know, he didn't take any food this morning. The purpose of the exercise was that I didn't even touch him. I listened to the parents. You listen to the stories.
Right.
We listen to the vital signs. You need to be able to get vital signs. The technology is out there right now that it's almost incredible with something on their hand that we can get blood pressure, oxygen saturation, respiratory rate. All right, these are important things that physicians who are parents of autistic kids have been looking for years. If you match technology and you match listening to the staff or the parents, I think you'll see less unnecessary admissions. And I hate to say this, unless it's unnecessary deaths. So.
Is it possible to set up a place that's like an EMO place that's just for autistic kids, where, you know, a place where all the autistic kids can just come for their regular doctor's appointments? You have all the different doctors all there in one place, kind of like a hospital type of a place without. Have you ever thought of that?
I haven't thought of that yet. I am focused on that population only right now. I have treated all kinds of kids with special needs, cerebral palsy, Down syndrome, but I am focusing on that population only because it's personal and I know it's challenging, but challenging means we have to do this. Not we want to do it, we have to do it. So we're going to start with a pilot. And we're going to start.
I'd love to see all these different specialists all in one place. And it can be like the main hub for all kids with autism. This is where you go and you have all the doctors that you need. They're all in the same place. Bring them for all of their doctor's appointments. The neurologists, everybody. Yeah.
Well, it's interesting because one of the things that I just started recently was a group, physician parent group who have kids with autism. Because if you're a specialist, we already have ER, hematology, oncology, infectious disease, pain management, physiatry, you know, we have orthopedics, we have it all list. Well, you get it. I don't have to teach it to you, you live it. And you start with that, and that then helps the non-physician parents understand that these physicians are autism friendly. Right. We get it. This is the hospital where the ER doctor, he's got a kid, he gets it. Right. This is the guy who's a physiatrist, I get it. Right. You got to start building the infrastructure.
You got 900 of them.
Right.
That's crazy.
And it's growing.
What are they doing down at Rutgers? There's an autism center down there or something?
Yeah, it's a day program, adult day program that they have. But what is really exciting that we're pushing, which is amazing that they're doing, that just started. And my son just got in there and I'm working with them as well. What is the project that we're talking about is a actual day crisis intervention program where during the daytime, then they go home, back and forth. They can work intensified with top BCBA specialists from Kennedy Krieger and with medical physicians like myself, training other physicians. It's amazing. We just need the funding. We're waiting for Rutgers to give us the funding and DDD to do this. But this, we're going to keep data, will be amazing because you don't have to stay overnight. And there's always a problem when a kid comes into a hospital, he stays there for 3 days. Now where are they going to go to a crisis place? And maybe they don't need it. Maybe it was a simple medical issue. Right. We're hoping it is. And that set them off. Something was a trigger. The other day, my son was having a problem. I don't know what the staff calls me. Well, let's go through a system check. Oh, maybe he cracked his tooth. I'm working with dentists right now constantly. Okay. Because I do not believe in the old school where I had to take him to the hospital, as you know, that's how we do it. And you have to admit him. And for a whole morning, he's under anesthesia and they're replacing all the cavities and doing this. Now that seizures are flying all over the place, that's insanity. We have surgery centers that we own. Why can't we do it in a surgery center? Okay. We've got to find a better way. That's expensive and unnecessary and arduous. So we're working with dentists. We're also desensitizing. In the school, the DLC, when Mikey left, I gave them a present. I said, I know you have this wonderful bank and hardware store and everything there, but what really saves lives is what we just talked about, doctor's offices. And I created a simulated doctor's office with them, with an X-ray machine, a lab, and everything else, so they can start early desensitizing these children as they grow older, so they're not afraid of an otoscope, ophthalmoscope, stethoscope. Why? Because X-rays will tell you if there's pneumonia. X-rays will tell you lots of things. Most of these kids, 30%, like my son, Mikey, has seizures. He needs blood drawn. That is a feat. It took years to get him to be less anxious. It's all about anxiety. It's not the pain, it's the anxiety of the situation. So desensitize them. So there's a little lab drawing area there. There's everything going on and it's going so well. I would love to see more of that because that makes, if you start early, it makes the end game a lot easier in the ER, urgent care, or even in the office. So desensitization is important. So there's so many things to do and we're doing them. And that's the thing. I'm not waiting. As you know, we talked earlier, I'm not the kind of person. I've met with governors and commissioners and other representatives. I always say that I'm not interested in the politics of things. Okay. I could do more in a day than they could do in a year. Okay. And here's the other thing I say to them. We do not have the luxury, you and I and everybody else, of time. Time is not a luxury. Many of these people are in hell. We need to get them out. We need to throw a life raft, put our hand out and says, we got your back.
Right.
We're going to help you. But we need other people motivated to start creating things, to do things, roll up our sleeves, you know? And I think we're on that journey right now. And it's interesting how this affects siblings. My daughter, who was going to be a doctor, ended up becoming a special needs attorney. And has rarely lost a case in New York because every time she walks in there, she's very much like your daughter, Patty. We always say this. She believes she represents Mikey.
Right.
That's how she treats.
Right.
And she just slays people right and left. And then her passion comes through. So there is some good of a bad situation. She had a very, very difficult time because we made her be a mother, second mother,
right,
and a therapist at a young age. So, you know, it's people need to find themselves and find out what motivates them. And I always tell my kids, you got to help the people behind you in life. That's the way it works. There's people suffering.
right.
There's more and more. What you're doing through media and exposure and telling your story. Let me tell you something. I built the first home idea was 12 years ago, and now we're doing another one that's even better. And the reason I did it is because my daughter had written an essay that I did not know about, that my wife showed me, that she cries herself to sleep at night, knowing that she's going to be responsible for her brother when we're done. And I thought that was like a knife thrown into me. And I looked at my wife and I said to her, there's some things in autism I have no control over, but some things I can. We're going to build a home. Unfortunately, it did not go the first home after it's up and running the way I wanted it to be with my partners. They were looking for the high functioning. I was trying to address the public needs of the lower functioning, middle to lower. Second time around will be nice. It'll have everything that I want it to be. But housing is important, quality of housing. You know, we learn a lot from our kids. We learn a lot from what's going on, but they all know that we have to help each other through this. We can't wait for politics or money, grants and things. That's just not it. I mean, and these stories have hit me for years at the think tank. You know, sometimes I hear of inclusion in a school, and I remember I worked with a team of attorneys, and their idea of inclusion was to lock a kid in the janitorial closet while the class was going on. And I said to them, to the family, don't worry about the legal costs. That's on me. That case was settled. I mean, a mom with 5 kids and 3 are autistic, single mom, you got me at the first part. However, it can't be all things for everybody, but we all need people to start being motivated and mobilized, and things will happen. The world is changing now from where we were in the beginning, and it's our job to move the dial. And like I always said to them when I had to build the addition, I've said to other ththings, there's some things in life you want to do, and some things you have to do. I have to do these things. I stay at night. I'm sure I'm unfortunately now, but other parents do. But with Robbie before, when Robbie was at the DLC, what kept you up at night? Where's he going to live? That's what's on every single parent's mind right now. Mm-hmm. This population is it's coming. They're falling off the cliff. I hear this all the time. And we have to do this. Do you understand what I'm saying? There's no more time to argue, to discuss, to debate, whatever. Just roll up your sleeves, start doing it.
Mm-hmm. Yeah. Yeah. And I keep saying it's going to take parents to get it done. You can't sit around and wait for politicians to do it and other people to do it, because it won't get done. The parents have to do it. And that's what I'm trying to motivate other parents through all these interviews, as I interview other parents who are doing things, starting foundations and helping other people. It's the only way it's going to get done. And I think about this sometimes too, because I don't live in the autism world anymore. And I could have said, my job's over, it's done, it's not my problem anymore. But I can't do that. I can't, because I know what it's like, and I know what these parents are going through, and I can't sit back and do nothing and say, I don't care, not my problem, And I feel like Robbie he's pushing me from heaven. He's like, no, Mom, you got to keep going. You got to keep going. You got to do it. You got to help. You got to help. So I'm very happy that I got a chance to meet you and meet somebody that's as passionate as I am about getting stuff done, and especially the medical component. I think it's huge. I think we both are on the same page with there needs to be housing. These kids need a secure place to live with people that are well paid, well trained, and also just dealing with the whole, like we discussed, everything's a trip to the hospital, and that's got to get fixed too. Like if there's nurses on staff that are right there, that can, I think that's huge. All you need is a nurse that's there to be. When I met a politician that was running for office, and he met with a bunch of autism parents, and he was shocked when he heard that minimum wage people with no training are giving them their meds every day. He's like, what? I was like, that's just how it works. He couldn't believe it. And I was like, well, and so in my mind, my dream place that I want to build, there's going to be a nurse there on staff. And I wanted an immediate connection to the medical community too. I think it's really important, and you're doing it. So kudos.
Yeah. Kudos to you. And, it's amazing what you're doing too. And I applaud you for this. I really do. And, it's personal, with your daughter and your son and our connection. But we wear 2 hats, and during the day I see patients, and the other days I'm doing what we have to do. Like you said, I could have just walked away. Well, Mikey's good. That's great.
Exactly. Yeah.
But that's not our mojo, you and I and a lot of other people that I know. You got to help the people behind you. And there's a lot of work to be done. And
there's so many coming up behind us, which is the problem.
Well, that's it. That's scary. It's terrifying.
Yeah.
Terrifying.
Yeah. Yeah, it really is. Really is. All right. I want to let you go. I've had you on here for a long time. Thank you so much for joining me today and for doing this interview. And and for everything that you're doing for the autism community. So thank you very much. You have a good day.
Thank you. You too.
That's it for today's episode. I hope you enjoyed listening and it helped you gain a new perspective. If you're interested in buying our book series, Robbie's World and His Spectrum of Adventures, the link will be in our episode description, as well as my Instagram and Facebook pages. If you enjoyed the show and you'd like more content, please be sure to hit that like button, follow us, and don't forget to leave us a great review. Thank you for joining us. Be sure to join us again on our next episode of Spectrum Perspectives.
Thank you for joining us today. Be sure to join us again on our next episode of Spectrum Perspectives.